Tweet activity at a healthcare conference can sometimes be overwhelming. Even those events that are specific to a given medical specialty will have tweet streams that are as diversified as the practice of medicine itself. This video will demonstrate how leveraging word filters can rein all that noise in and get you focused on the discussions around the specific topics you're interested in, and identify leading voices in the discussion. For this exercise, let's assume that our organization is developing new treatment options related to non-small cell lung cancer. The European Society of Medical Oncology's conference has just taken place, and we want to identify doctors who are digital opinion influencers in that specific therapeutic area and who were actively engaged in that discussion on Twitter during the conference. To do that, let's build a dashboard. I'm going to click right in here where the search bar is and put in the conference hashtag, ESMO20. I'll select that, and then I'm going to set my date range. We'll start it from the 17th of September, and we'll run that through the 23rd. Then I'll choose my Create button. When the dashboard populates, note the summary numbers. This is the complete and unfiltered tweet stream produced by all participants during the selected dates, with 28,000 total tweets by more than 5,000 unique individual users. But we're not interested in all of that. We're interested in the non-small cell lung cancer conversation that took place there and who the most influential physicians were that were involved in that very specific discussion. To do that, we'll want to use some simple filtering of the data on this dashboard. So I'm going to click on the Add Filter option at the very top, and I'm going to choose a word filter. Now, we've got the option here to contains any or contains all. We're going to choose contains any, and then I'll make a list of those terms that I want to make sure are in the tweets that we're going to surface on this dashboard. Things like non-small cell. Then I make a comma. Now put in another term, maybe non-small cell without the hyphen, or maybe popular abbreviation, NSCLC, non-small cell lung cancer, or hashtag non-small cell. You get the idea. Now I'm going to choose my Run button to repopulate the dashboard. And there we go. Note the change in the summary numbers. The tweets on this dashboard are now limited to just those that also include one or more of the words that were just placed in that filter. Now we're looking at a little less than 2,000 tweets and just over 800 unique individual users. Now, since the goal is to determine the most influential doctors in this conversation, I'm going to go straight to the influencer section of the dashboard. By default, the results are showing the most influential parties according to our proprietary simpler rank algorithm that looks at who is receiving the highest quality of engagement. There are alternative metrics that you can select from, but we find simpler rank to be very trustworthy as a measurement of true influence. It's a very complex algorithm that loops through itself countless times, but at its core, it judges influence based on the engagement that one receives. Now, that said, we do not believe that all engagement is equal. For example, if a known doctor, academic, or patient advocate begins to engage with you, we will give more weight to those engagements than we would if the party engaging with you was someone who has very little involvement in healthcare-related discussions typically. Maybe they mostly tweet about sports all day, or if the mentions of you are coming from a known spam account. In those latter two examples, we would discount or even ignore those engagements. And if you're discussing a specific disease, like we're looking at non-small cell lung cancer right now, and you're receiving engagement from other parties who are known to be influential on that specific topic, then once again, we will give more weight to those engagements than if they were coming from someone who carries less or no influence on that topic. So rather than looking at simple quantitative metrics like how many engagements did someone receive, we look at the qualitative aspects of those engagements by looking at who they are coming from. Then we apply a scoring system of 0 to 100, and the top score will always be 100, and everyone else falls in line from there. Now, right now, we're looking at a top 100 list. You can build that out larger if needed. I'm just going to leave it be here. And these buttons up at the top, they are in the order of which stakeholders have the highest representation in this list. And I can see here that there's 59 doctors on it. And if I click on the doctor button, the results are now filtered to just show who the known doctors are in that list of most influential participants and in what order. Now, maybe you'll want to export this list, and doing so can be useful for a variety of reasons. You can extract the Twitter handles from the list and use them to populate a dashboard that monitors this select group going forward. You could import the data into other analytics software that you're perhaps using, or you can merge this list with existing internal influencer lists. Exporting is easy. I'll just pick this gear icon that you'll find in the upper right-hand corner of each section of the dashboard. And here's where I've got my options and settings, including export to CSV. When I choose that, the file has now been downloaded into my downloads folder, and I can easily access it. Using our simpler rank algorithm, I know these are the doctors who were receiving the highest quality engagement in the non-small cell lung cancer conversation at this conference. Maybe I recognize many, or even most of them, but maybe there are some new faces here who I've not been familiar with. And I may want to watch for them at other events, or even in ongoing conversations on Twitter that are focused on non-small cell lung cancer. After all, maintaining an opinion leader list is a constant effort. And with our dashboards, it's just a few clicks to keep your finger on the pulse. Quick and easy.